All right, let's talk about one of the most fundamental skills in reading an ECG, the QRS axis. Now, I know it sounds a little intimidating, right? But what if I told you it's basically just finding the direction of a compass? Every single heartbeat has an average direction of travel, and our job is to figure out which way that electrical compass is pointing. It's a game changer once you get it.
So yeah, every single beat has a direction. Think about it. All those little electrical signals firing to make your ventricles pump, they all add up to one big average direction. And finding that direction, well, that can tell you a ton about what's going on with the heart. So let's do it. We're going to break down how to find the axis and, the really important part, what it all means.
Okay, so here's the plan. First, we'll get our heads around this whole electrical compass idea. Then we'll talk about why you should even care, why it matters in the real world. After that, I'll show you 2 super simple ways to find the axis. And to wrap it all up, we'll figure out what it means when that compass is pointing in the wrong direction and what could be causing it. Sound good? Let's go. All right, section 1, the heart's electrical compass. So what exactly is the QRS axis? Before we jump into finding it, we gotta be on the same page about what it is we're even looking for. So here's the official definition, but let's break it down. Imagine a huge crowd of people all trying to leave a stadium at once. They're all moving in slightly different directions, but overall, the whole crowd is moving towards the main exit, right? The QRS axis is like that main exit path for the heart's electricity. It's the average direction of all that electrical energy. And because the left ventricle is this big muscular powerhouse, it has the biggest electrical voice. So naturally, the average direction, our normal axis, is going to point right towards it, down and to the left. And this is our map. It's called the hexoaxial reference system, which is just a fancy way of saying we've taken the 6 limb leads and arranged them into a 360-degree circle. Think of each lead as a camera pointed at the heart from a different angle. By looking at what all 6 cameras see, we can get a perfect frontal plane view of which way that electrical signal is heading. Okay, but why does any of this matter? You might be thinking, is this just something they teach you to make ECGs seem harder? No way. An abnormal axis is a huge deal. It's often the very first clue that something's not right with the heart. I mean, look at this list. When that axis shifts out of its normal zone, it's a massive red flag. It could mean the heart muscle itself has changed. Maybe it's gotten thicker. Or it could mean there's damage, like from a past heart attack. Or maybe the heart's wiring, the conduction system, is on the fritz. It doesn't give you a final diagnosis, no, but man, does it tell you exactly where you need to start digging. Okay, let's get our hands dirty. How do we actually find this thing? There are a few ways to do it, but we're going to focus on 2 really practical methods. We'll start with the super fast one, the one you can do in seconds. This is called the quadrant method, and honestly, it's your best friend for a quick look. All you need are 2 leads, lead I and lead AVF. That's it. And the process is ridiculously simple. Step 1, look at lead 1. Is the QRS mostly pointing up? Is it positive? Or is it mostly pointing down? Negative. Step 2, do the exact same thing for lead AVF. Is it mostly positive or negative? You combine those 2 answers, and boom, you know which of the 4 quadrants the axis is in. It's that fast. And this table just puts it all together beautifully. Check it out. If lead I is positive and lead AVF is positive, that's 2 thumbs up, you've got a normal axis. You're done. If lead I is positive but AVF is negative, they're leaving each other, so you have a left axis deviation. If they're both negative, that's extreme. See? It's a really cool and simple shortcut to get you in the right ballpark almost instantly. So the quadrant method is awesome for getting a quick idea, but sometimes you need to be more precise. You need an actual number. For that, we turn to the isoelectric method. Okay, this one sounds a little more complicated, but the logic is actually pretty cool. The whole idea is based on this one fact. The main electrical direction of the heart is always going to be perfectly perpendicular, a 90-degree angle, to the one ECG lead that sees it as flat, or isoelectric. So your job is to find the flattest lead, the one where the up and down parts of the QRS are basically equal. Once you find that lead, you just look at your hexaxial map, find the lead that's 90 degrees away from it, and that's your axis. Simple as that. All right, so you've done the work, you've found the axis. What now? Well, that number is going to land you in one of 4 camps. And this chart lays it all out for you. That big green chunk, from -30 all the way to plus 90 degrees, that's normal. That's where you want to be. But if your axis falls into that upper left blue section, that's left axis deviation. If it's in the yellow section on the right, That's right axis deviation. And that little red slice up top, that's the one you don't see very often, extreme axis deviation. So let's put it all together. If you have left axis deviation, it means the electricity is heading up and to the left. So lead I, which is looking from the left, sees it coming, so the QRS is positive. But leads AVF and I, which are looking up from the bottom, see the electricity running away from them, so their QRS is negative. See how that works? And for right axis deviation, it's just the reverse. The electricity is going away from lead I, so lead I is negative.
Okay, now for the most important part. Let's connect the dots. What do these axis deviations actually mean clinically? What's going on with the patient?
So when you see left axis deviation, or LAD, your brain should immediately start thinking about things that make the left side of the heart electrically, well, bigger or different. The classic one is left ventricular hypertrophy. The muscle wall gets super thick and literally pulls the electrical axis over to its side. Or you could have a block in the wiring, like a left bundle branch block, that forces the electricity to take a detour up and to the left. And for right axis deviation, or RAD, you just flip your thinking to the right side of the heart. What could be causing strain over there? A big one is a pulmonary embolism, or maybe chronic lung disease like COPD, which puts a ton of pressure on the right ventricle. But here's a really interesting thing. RAD isn't always bad. You can actually see it as a normal finding in kids or even in really tall, thin adults just because of the way their heart physically sits in their chest.
Finally, we've got extreme axis deviation. This one is sometimes called a northwest axis. And when you see it, you gotta pay attention. It's almost always a sign of something serious. We're talking about things like ventricular rhythms, like VTach, or a major electrolyte problem, like dangerously high potassium. But before you panic, what's the very first thing you should always check? That the leads are on correctly. A simple limb lead reversal is a common cause.
Yeah, this quote from the ECG Learning Center really nails it. The big takeaway here is that the QRS axis is so much more than just a number you calculate. It's a clue. It's a signpost that points you towards myocardial damage or a change in how the ventricles are firing. It's a seriously powerful diagnostic tool. So there you have it. Once you can read the heart's compass, you've really leveled up your ECG game. It's a skill that opens the door to understanding so much more about what's happening electrically inside the heart. The only question left is, what are you going to master next?